It's the Thursday Morning House Call with Dr. Lane Aiena. Brought to you by Huntsville Memorial Hospital.
Hey, good morning. Big Lane Edwards with you in studio with me, Dr. Lane Aiena. Good morning, Dr. Lane.
Good morning. How you doing today?
Doing great. It's Friday Eve. The weekend is upon us. You can practically touch it already.
Yes, it's so close.
But it's going to be a hot one.
It is, and I am helping friend of the show, Danny, move even closer to us. And luckily, me and him are used to hard work on hot days, so I think we'll be okay.
But the positive is he's moving closer.
He is. He's moving to the Bryan College Station area, so that'll be exciting. It'll be exciting to see him more often. And the kids are already super excited that Danny's coming.
Uncle Danny,
Uncle
right?
Danny's coming.
I love it.
Initially, Bobby thought he was moving in with us. We told him no. Doesn't work that way with grown-ups, but hey, it's cute that he thought so.
All right, so what are we talking about today?
So one of the, not the most common phrase I hear is when patients either proudly proclaim or sheepishly say, "So I was looking it up. I saw it on Google." Dr. Google. So I thought, why don't we do an episode about Dr. Google? And I'm going to come out with what might surprise you. Googling things about medicine isn't all bad and it's not all wrong. I know that we only have 15 minutes to talk, so sometimes you may leave with the impression of don't do that, because I hear it 30 times a day. So honestly, it doesn't bother me more. I don't know of any doctors that it bothers anymore because it's just, eventually it's just become part of the job. But if you're looking up things, common illnesses, common cold, basic anatomy is great, maybe a few basic questions about common medications, the things that are really common. The internet's gotten a lot better, honestly. Even AI can be helpful for very basic things. Other things that Google AI can be useful for, not diagnosing, don't mishear me here, but helping you be an informed patient. Hey, Google, hey, ChatGPT, hey, Claude, here's the symptoms I'm having. If it's responsible, it will still tell you to go to your doctor, but it may tell you, here are some questions you should bring up to your doctor. I love that. I don't take any personal affront to that. If you are a well-educated, well-informed patient, you will absolutely get more out of your visit. And you will retain more of what I tell you. You'll retain more of the advice, which will make you able to remember and do more, which should positively affect your health. So please don't mishear me when I say, Dr. Google. There are positives from it. Now, there are negatives as well. First of all, you need to check your sources. And if there is one thing you take away from this episode, it is that you need to check your sources. The American Academy of Family Physicians is phenomenal. And I'm not even saying that as a family physician, as a homer. It is a great resource. They intentionally make it where patients can read it and understand it and digest it. For me, they make it to where I can read it at the bedside and quickly utilize the information. It's wonderful. The CDC, Mayo Clinic, things that you know the name when you hear it, those are all good. Those are all reputable resources. The CDC actually has some really good resources that are very readable. I still use the CDC when I see my pediatric patients for milestones because sometimes they get updated and make sure I don't forget one. Great resource. HippieGranolaMom.com may not be giving you the best advice. I know that a lot of people get called by the siren song of alternative holistic medicine, but you have to be careful. You have to remember that websites like that thrive on your clicks. And if they are giving you a cure-all, here's the second thing I want you to remember from this episode. Cure-alls cure nothing, period. I wish I could say that every week. Cure-alls cure nothing. If it starts to list all of the things it cures, you have to scroll to see the next section. It is worthless. Trust me. There are things that treat multiple ailments. Look at the new GLP-1 drugs. They treat diabetes. They help with obesity. There's some indications they may help with inflammation. Great. That is a well-studied, well-known medication, and it's still not curing all. It doesn't cure cancer. It doesn't cure the cold. So you've got to be really cautious when you're reading these websites. If you are on Facebook and you see a medical link, do not tell me. Do not read it. Do not bring it to me. Facebook benefits from edgy, fake information that generates clicks. That is what makes money. Things that are contrarian. You're not going to click on statins are good for you because deep down you kind of know it, right? You'd rather hear which statin could be killing you. Well, I'm clicking that all day. So remember, Facebook is not your friend. Facebook is here to make money. Full disclosure, I can't stand Facebook. I can't stand social media, so I don't use them. Full disclosure. There, I got it out in the open. But please, folks, folks. We are making a big distinction here between Google, ChatGPT, Claude, and social media medical advice, right? Bob down the road probably doesn't know what's going on with your chest pain. And speaking of, my last point, if you're having chest pain, if you're having confusion, if you're having very high fevers, if you're bleeding, don't Google it. Come see me or go to the emergency room.
You go to Huntsville
Memorial Hospital emergency room. Yeah. Folks, if it's an emergency room, you don't have time to Google, and you certainly don't have time for it might be wrong. So in a nutshell, for the basic things to help educate yourself, to make yourself an informed patient, go for it. Bring it to me. Tell me what you read. I'm happy to hear it. And let's talk about it. Absolutely. Be very wary of what you find on social media, and I'm being generous with that. Be very wary. Cure-alls cure nothing. And if it's an emergency, put your phone down unless you're using it to call me.
All right, there you go. Great advice from Dr. Aiena. This week's edition of the Thursday Morning Health Call brought to you by Huntsville Memorial Hospital.
Let's keep Huntsville healthy.